So which of the following is the most likely diagnosis? So a 65-year-old man with a history of hypertension presents to the emergency department with a sudden onset of severe headache, nausea, and vomiting, and altered mental status. On examination, the patient is found to have left-sided hemiparesis and rigidity on his neck. A CT scan, a non-contrast CT scan of the head reveals a large area of hyperdensity and right parietal lobe without extension to the subarachnoid space. The physician suspects the patient has a type of intracranial hemorrhage. Um, so let's see, hyperintensity on the right parietal lobe. Okay, so there's no sign of it being due to trauma.
Okay.
So right off the bat, okay, no, I'm using my other methods. But it's not anything like subdural or subarachnoid or like stuff like that.
Okay.
Um, intraparenchymal could be it
Okay.
because of the yeah, I'm gonna go with that, although I'm not quite sure.
Okay, so let's talk about this, right? Presentation severe, onset severe headache, nausea, vomiting, mental status, left side perimus, and rigidity of the neck. CT findings with the parietal without extension into subarachnoid space. So it can't be a subarachnoid hemorrhage. And subdural is not going to be inside, right? So intraparenchymal means like, deep inside the brain, right? Which makes sense, right? Because that's usually caused by hypertension, right? Which the patient has a symptom of. AV malformation, unlikely here. Cerebral amyloid angiopathy, right? That usually, you have some kind of amyloidosis, which she doesn't have history of. Subarachnoid hemorrhage, like we said, right? Usually like Barry aneurysms that rupture, right? So Barry aneurysm, as in a saccular aneurysm on the circle of Willis that rupture, that can cause kind of subarachnoid hemorrhage. That's not what's going on here. And subdural hematoma, right? That's usually from trauma of old age, right? Shearing of the venous system, and it's not going to be shown deep within the brain. So when it's deep within the brain, like that, intraparenchymal just means like deep within the brain. So good, but definitely know kind of make sure you understand kind of the terminology here.
Okay.
Okay.